Hi, good day to you all. I'm Dr. R.K. Swathi, ENT surgeon. I finished my MBBS from Dr. B.R. Ambedkar Medical College, Bangalore, and MS from Kempegowda Institute of Medical Sciences, Bangalore. I, I have an experience of 8 years in the field of ENT. I am associated with Madhu Hospital since 1 year. There is the in-house CT which is so helpful. Many of us complain of sinusitis, so immediately we can get one CT PNS done. Especially coronal cuts will give us good anatomical differentiation, and they give it on time, and reporting is also good. There is digital x-ray also, and lab also, bedside lab is available. So all the test which is required pre-op and post-op if necessary can be done very easily. The most common ENT problem that people face is allergic rhinitis. It is also called hay fever. The most common symptoms are sneezing, rhinitis, then we have irritation, itching, then eye symptoms like eye itching, eye irritation, congestion, and throat itching, cough, etc. Even some complain of skin rashes, that is called atopy. Then we have usually why we get allergic rhinitis symptoms is because of allergic immune response to a particular allergen. There are many allergens. So main allergen will be the dust. So dust is dust in the sense dust mite is the organism which causes allergic rhinitis. Then we have pollen grains, which is more common in Bangalore. Then it is seasonal also, or otherwise present throughout the year. It is called perennial also. Then pet dander, mold, insects, food, and other things. Then the symptoms of allergic rhinitis reduces the quality of life. That is the most important issue nowadays. They are not able to perform their activities, day-to-day activities. If we take medicines for the same symptoms, there will be like drowsiness. Then in the surrounding workplace, they find it very difficult to manage. Exposure to dust, if they are traffic police for example, definitely they will be exposed to dust. So no other go, they have to get adapted to that situation and they have to go on. Similarly, some complain of workplace AC, that is also a problem. Internal air circulation which is causing this problem. Otherwise, people at home like housewives complain of allergic rhinitis because of dusting, and some cooking dust also causes like this. Many issues, common issues are there which causes allergic rhinitis symptoms. Now major thing is we have to avoid. That is the only preventive thing. Like whatever is the allergen which is causing you the problem, we have to avoid that. So that is called avoidance of the triggers. So that is the best medicine. The next will be other things like breathing exercises, which will really help us come out of this issue. Then maintenance medicines which is given by the doctor to be taken. Then if it is seasonal, we have to continue the medicines for that particular season. So these are a few things we have to follow. Blood test, in the sense there are two important blood tests which is done to see if we have any major issue, that is absolute eosinophil count, AEC, and IgE levels, because this allergic response is due to IgE mediated reaction. So these two will tell us if we have eosinophilia. If that particular eosinophil count is more, then we have a specific treatment for the same. Other important patient awareness is patient with atopy and asthma should be very careful. Any trigger that increases this problem should be taken to the doctor, specialist, so that they can initially evaluate and cure the issue. Then there are some warning signs, like there is just breathlessness or cough, or there is increased sneezing, running nose, which you are not able to tolerate. Definitely you would seek a ENT specialist or any specialist opinion. Then if the symptoms subside with the home remedy, we need not worry. So home remedies, I'll tell a few things. First is like steam inhalation. That is with plain water. We need not add Vicks or any other things in the water. Just plain water steam inhalation will do good. So that will help us. Then usage of nasal sprays, that is intranasal nasal steroid sprays, which will give us good benefit. Then you can avoid dust, like while you're dusting or doing any cleaning activity, we can use mask, which will help us create a barrier. Then we can use humidifiers or air purifiers at home. That is a little high level, but still that is also a point which can be added. Then a simple remedy is we have to change our pillow covers, bed sheets regularly. That is once in 2 to 3 days. That will help us get rid of dust mites, which are the major cause of allergic rhinitis. Also, we have newly immunotherapy. That is, we have with the help of skin prick test, we can identify the specific allergen which we are allergic to, and hence we can treat it with specific immunoglobulins. This is the recent advances. Otherwise, if any patients with asthma who are facing allergic rhinitis should always keep in mind that we have to seek medical attention when we have even the minimal symptoms. So period from October to Jan, definitely there will be like atmosphere will be very cold and will be subjected to many infections. So we should be careful and avoid the triggers. So take home messages: allergic rhinitis can be controlled only by avoidance of triggers. So all of you can make use of the facilities available in Madhu Hospital. Thank you.